Hello and welcome. My name is Elizabeth Sanders and I'm a science teacher at the Galloway School in Atlanta, Georgia. This conversation tonight is an outgrowth of a class called Human Diseases and Conditions. As you can imagine, our learning this semester has shifted significantly to focus on the COVID-19 pandemic. One of the sources we've explored is local NPR station WABE's podcast devoted to the topic called Did You Wash Your Hands? And so it's a special privilege for us to have the opportunity to talk tonight with that podcast's creator and WABE health correspondent, Sam Whitehead. Welcome, Sam. And I'm also pleased to introduce Jayla Brown, a senior at the Galloway School who will interview Sam on behalf of our class. Jayla is headed next year to the University of Arizona, where she plans to study journalism with a goal of making news more accessible to everyone. Welcome, Jayla. Before I hand this conversation over to Jayla, I want also to welcome those of you who have joined us live and note that a recording of tonight's interview, as well as games, infographics, articles, and videos we've made to share our learning will be available online. The beta version is live tomorrow at 9. I'll put the link to that as well as to the WABE podcast in our Zoom chat. Now, without further ado, Jayla, take it away.
Okay, hi everyone. Like she said, I'm Jayla Brown. I'm here today with our guest, Sam Whitehead, WABE's health correspondent. And so to start off, my classmates and I listened to his podcast on NPR, Did You Wash Your Hands? And where each episode of the podcast covers a different light of COVID from first-person views. And it's basically just another source to really help the community really understand what's going on, especially around the greater Atlanta area. So before we get into it, Sam, how are you doing in quarantine? How's it been at your house? Kind of before I just attack you with questions. I think you're on mute. You're
okay,
on mute.
There we go. Hey, yeah, it just took me 1 second. Yeah. So how is life in quarantine? Can you hear me now? Jayla, do you have me? Can you hear me? Okay, great.
Yes.
It's been weird. Okay, cool. So it's been weird. I am often reminded of, I often think about the first press release I got about this from the CDC, that there was this weird new virus that they were going to do a press call about. And it was in January, I think. And it was something I had never heard of. It had a weird name and I actually skipped it. So this was the CDC telling the world for the first time that COVID was a thing. And it didn't even raise to the level of I didn't feel like I needed to spend time on it. So that was in January. We've been kind of sheltered in place for about 2 months now. I feel like the last day I went into work was March, sort of jumping in and out just sporadically to pick up my office plant to make sure it didn't die. So it's been weird, but everyone's kind of been going through this. The really cool thing about radio is that it doesn't take a lot of fancy equipment to actually put a show together. So my recording studio is literally me with a blanket over my head in the closet. Anyone with a smartphone essentially has a voice recorder in their pocket. And so there's a whole lot that you can do to produce a show from home. So it's been, like it's been for everyone, it's been weird to kind of be stuck at home and not going out and doing the things that I normally do. But at least for the work, I am still able to work, I think, pretty productively from home.
That's great. And so speaking of the production of the podcast, our first set of questions kind of go into the setup of your interviews / the process of getting with the interviewees. So our first question is, how do you decide what topics to bring up on the show / how do you formulate each question depending on who you are talking to?
So let's take the topics one first. I feel like for the first week or two of doing this, I just had kind of like a brain dump list where it's every email I got that set off an idea oh, I should do an episode about this, that goes down on a list, and the ideas I get back to those later. So I'll say now, I think we just released our 35th episode today, which is 7 full weeks, which is a lot. I still have a long list of topics that I've yet to get to.
Congratulations.
Some of it is dictated by the, oh yeah, thank you. Some of it is dictated by the news of the day. So, Governor Kemp does a press conference and we want to talk about what he announced, right? That's something that we want to bring to our listeners because it's in the news. Maybe something big has been announced, something has changed, and we want to talk about it. And then that's kind of filled in with voices that are maybe in episodes that are maybe a little bit harder to put together. You mentioned some of these kind of first person voices that we have. Those are voices that are actually really hard to find. It's not easy, especially because we can't go out on the street and put a microphone in someone's face like we used to be able to. We can't just go ask a random stranger, hey, tell me your story. And so that takes a little bit more time, but the idea is that it's time well spent because then you do bring those kind of unofficial voices onto the show. As to how we figure out what to ask people, when you're producing anything for a general audience, I always try to think about what basic questions do my listeners have that they need answered. I've been covering health for about 1.5 years now for WABE, so I know a fair bit about the beat and different topics within it, but my listener doesn't. And I think with any kind of radio that is good and accessible, you want to make sure that you are kind of anticipating the questions that your general listener might have, and then asking your guest those questions. But also finding ways to take your listener from maybe a general knowledge starting point and really help them learn something through the course of an episode. Something that they didn't know before, they maybe hadn't thought of. And you can do that, I think, if you understand kind of maybe where they're starting, and you just have to really be cognizant of guiding them through the course of an interview to maybe learning something new.
Yeah. So that goes into, well, based on these interviews, have you had a conversation so far that kind of that stood out and gave you like a different view on the pandemic based on what you knew before and then after the interview?
That's a good question. The thing that everyone, I think, is grappling with at this point is there are no real experts on this thing. This isn't influenza that we've known about for a long time. This is a novel virus. And I guess the thing that I have been surprised by is how even some of the quote unquote experts, maybe in public health or, maybe they're medical doctors, maybe they're virologists that I've talked with, they are still very aware of how much they don't know. And I would say that instead of maybe one conversation that has really stood out to me where I feel like I've learned something, it's more, even some of the smartest people that I've spoken with are just very aware of the fact that there are just huge gaps in our knowledge about this thing. And if anything kind of guides how I feel about this entire situation, which is that we're probably going to be dealing with this a lot longer than anyone publicly is talking about. It comes from this fact that even like the very smart people I'm talking to are very aware of the limitations of our knowledge currently. So that's kind of the thing that's really stuck with me, but it's also made this exciting, right? Because it like for this topic, if we're starting at our knowledge base that's very, very small, there's just so much more room we can expand into.
Yeah. Since you have talked to many people ranging from like everyday workers to public officials, one of my classmates also asked, so after one set interview, how do you kind of like take on the task of moving forward while also learning new information? Like, how do you like stay on topic while also like getting new information every day?
So maybe the question is like, how do I produce this show, but then also like keep up with the news at the same time?
Yes.
Okay. Okay. Yeah. It's not easy.
Sorry, it's kind of
You know,
freezing.
no, it's good. I can hear you. It's just, there's a little bit of a delay. It is hard. I will say that my email inbox is normally very full. I feel like it's especially full these days. Like I'll step away from my computer for maybe an hour and I'll easily have 25 new emails in there from different government agencies, from say different hospitals or universities who are trying to get me to cover a story, something that they have that is related to this, from like PR people. Every business who makes any kind of product in the world that you can think of is trying to capitalize on this moment. And so like I've gotten PR pitches from people that are like, here are the best dog biscuits for you to feed your dog while you're in quarantine. So there's a lot of stuff to sort through. So that is hard. I mean, a big part of what I do each day is just carve out time in the morning to check in on what my own organization has been doing. A lot of our reporters in the WABE newsroom have kind of become health reporters because this is really the biggest story in the world right now. But there's also a lot of great reporting happening at other outlets here in the city and even nationally, internationally. So a big part of my day is literally just reading other people's work, seeing what they're looking at, and not only looking there for ideas and thinking, okay, well, here's a story I maybe saw in the New York Times or, you know, with BBC. Is there a local angle that is worth exploring? But also just to also learn what people are finding and as they cover it too.
Yeah. So the last thing before moving on to like, I guess the more specific questions, it would be, so I think it's very important for you to speak on the impact of journalism, especially like during these times where there can be what could be deemed as fake news or some people just being misinformed. As citizens being the news consumers, how could we possibly like protect ourselves from what we hear and like what to believe?
That's a big question, Jayla. That's a big question, I think, in any time. I will say, especially now, it's important. How do we protect ourselves? I don't know if you can protect yourselves from it. If we can protect ourselves from it, it's out there. You know, if you're on Twitter, you're going to see it. And, you know, if you're on Facebook, you're going to see it. So I don't know if it's so much of a question of like, how do you insulate or isolate yourself from it? Because I don't know if that's possible anymore. I feel like that, you know, that horse has left the barn. You know, I think it's important to understand that there are both governmental and non-governmental agencies that we can think of as maybe more of a gold standard when it comes to information about something like this. You know, despite the fact that the CDC has taken a lot of criticism for how they've handled COVID-19 in this specific pandemic, you know, if I have questions, I still go to the CDC. There are researchers at the CDC doing good work who aren't like the political people at the CDC, of which there are some, you know, higher ups. The World Health Organization is a great resource. I've often also found too that there are a number of great, both journalistic and more academic resources as well. I don't know if anyone on here has seen the Johns Hopkins University like COVID map that has like case breakouts by country, and it's just like a really beautiful piece of like digital design. That's a good resource. So it's really, if you see something that seems outrageous or maybe seems, you know, if it doesn't pass the smell test, I think it's always worth thinking about, okay, well, what does the CDC say about it? What does WHO say about it? The other thing that just to kind of mention something right now. Because this is still such a new virus, a lot of the research that's being done on it is still very new. And a lot of it hasn't had time to go through the normal peer review process that, say, a journal article has to do to get into a publication. What's happening right now, and I think what really scares worries a lot of health reporters, is that these kind of articles called preprints that really haven't gone through this rigorous review process will get attention. I've had multiple universities here in the state of Georgia email me pitches saying, hey, talk to this researcher about this preprint. And that gives me pause, because I'm not a medical doctor, I'm not a scientist. And so I don't feel well equipped to evaluate the validity of the work you're doing. To any kind of extent. I'm not running the New England Journal of Medicine. I don't have their review board at my disposal. And so I think that that's something to really be aware of, is if you hear or see something about a study, try to dig a little bit, because it's really easy, I think, for news organizations who aren't really rigorous about this stuff to really get attracted by this one study that says this one thing, when if you dig a little bit more into the methods and how that study has been reviewed or not, you'll find that maybe the headline that they put on their story isn't the actual story.
Yeah, I understand that, especially about what I've seen around with certain topics. And so thank you. And so now that we've kind of talked about journalism and what steps you take, I think that we should kind of get into my more controversial topics. And so kind of based on Georgia State right now, and the governor's rules at this moment. And so the first question is, do you personally think that it was morally or economically correct for Brian Kemp to allow businesses to reopen with the risk of increasing the coronavirus cases?
That is a controversial question. I will say this, and this is so the governor does weekly press conferences. He has been for a while now, and it's him, and it's Dr. Kathleen Toomey, who's the head of our public health department here. The head of the Georgia National Guard will speak. The head of GMA will speak. The thing that the governor again and again leans on is this idea that in this last few months, while we have all stayed home and done our best to keep away from other people, what that has allowed the state to do is expand the capacity to care for people who get sick. And so there was a lot of coverage early on in this pandemic about, I'm sure y'all all saw the modeling from the University of Washington Institute of Health Metrics, the kind of green and purple graph that showed us exceeding ICU bed capacity. And so what the governor will say is that we have the capacity now to treat people who get sick. Georgia has done things like set up a temporary hospital for people at the Georgia World Congress Center. The state of Georgia has sent kind of mobile ERs to different hotspots. Gainesville, Albany, I think Macon got one as well. Augusta got one. And I've had a lot of conversations with hospitals about the work that they have done to prepare for a surge of patients. Opening up new buildings, opening up wings of buildings they haven't used in years. So that is the governor's argument, is that we are prepared to help people who get sick. I think the tacit assumption in that argument is that people will get sick. And, I don't think it's my position to necessarily judge the morality of that, because I think the other side of that, Jayla, is the fact that state tax revenues in the month of April were down 35%. Mm-hmm. That's a lot of money. Yeah. And state agencies are now being asked to cut their budgets by 14%, no questions asked, no exemptions. And that's going to affect kids in public schools. That's going to affect services for people with intellectual and developmental disabilities here in the state. There are real impacts to the fact that the state is not making money right now because the economy isn't moving. I think the bigger question is, how do you balance out those economic costs with the idea that people are going to continue to get sick? I don't have that answer. And, you know, I'm glad I'm not the one who has to answer that question, because honestly, you know, like, and, you know, I've had many conversations with the governor's staff, just kind of about this stuff. And what they say again and again is that there are no easy decisions here. And despite any personal feelings I might have about these decisions, I will at least give them that. This is a hard situation. So that is about as, I feel like, as diplomatic as I can be without actually answering your question.
Okay, well, thank you. And so you mentioned a lot of things that could be underlying factors, like you mentioned income, you mentioned the economy in general, you mentioned public school, like kids being affected by all of this. And I actually listened to I listened to more than one of your podcasts, but I've listened to one with Dr. Jackson where you spoke about African American and the African American community and how they are being affected by it and like what bases are being like said. And so I just wanted you to kind of speak on, do you think it's because of all these underlying factors that already affected African Americans, or is coronavirus just affecting African Americans? Like, kind of your take on that.
Yeah, that's a great question. And I will say, you know, the answers, the thoughts that I might have on this, just for our audience who's watching, these are thoughts informed by conversations with people about this. These aren't just my opinions. So the specific, sorry. Oh, no, it's fine. Just because I know we've got a lot of people on, we've got some people on here. The thing about that study, which was so interesting. So for the audiences, this was a study of 300 patients here in the state of Georgia, about 300, I think 305 was the number. And the researchers behind this study actually told me that what they were doing, this was in March, there was so much unknown about this disease that they were just looking to learn anything about the outcomes of patients who had been hospitalized with COVID-19. They weren't going into this study looking at necessarily breakdowns by ethnicity or race or anything else. And so what they found is that in this sample of 305 patients, African Americans were overrepresented. Essentially, there were more of them than you would expect in your normal, you know, admission of 300 people to the hospital. And they actually started doing this work before we started seeing more and more data about how this disease is affecting some groups of people in different ways than others. The public health officials, Jayla, that I have spoken with, officials and researchers, think that it is not as simple as one group of people is somehow predetermined to be more affected by a virus. The indication seems to be, and I think that this is probably true with any kind of virus in any society, is that there are social factors for how these things spread. You know, societies that are more social are much more likely to spread a disease because, you know, if you're like a touchy-feely, huggy kind of society, viruses love that because then, you know, here's another vector. And so if, you know, people who live in multifamily households, where you have a number of generations living under the same roof, that presents a different kind of vulnerability. And then Jayla, I think what you're hitting on is underlying health conditions. I mean, it is no secret that Black people here in this country have less access to healthcare. They have less access to the resources that they need to keep themselves and their families healthy. And what this pandemic seems to be doing is shining a very bright light on that. The thing is, this is not some new reality. This is the reality. But what the pandemic does is just kind of really highlight it and highlight it at a time where the stakes are very high. And so I will say too about this study, even though African Americans were overrepresented in the sample of 300 people, the researchers found that they did not necessarily, once they were hospitalized, have more severe outcomes. So they weren't necessarily more likely to be put on a ventilator or die, but they were more likely to end up in a hospital. And I will say too, I think that the people I have talked to about this are maybe hopeful that what will come out of this pandemic is this realization that there are these inequities in our healthcare system, and that in the time that we are not fighting COVID-19, whatever that time looks like in the future, that will be a time for everyone to really focus on the fact that, there are these disparities, and when they really matter. I mean, they always matter, but we're going to get a very stark reminder of what they are when there is this kind of public health crisis.
Yeah, well, yes. And so, as you mentioned earlier, like, even if we do kind of open back up, people are still going to continue to get sick. Like, that's not just going to obviously stop immediately. And so, if there is a lag in collecting data on coronavirus cases in Georgia, do you believe that there should be maybe that we should enforce stricter social distancing measures, while even though things are being open, should measures should be stricter, based on should social distancing measures be stricter even though we are kind of out of the shelter in place area of this pandemic?
Yeah, that I think goes back to the first question I dodged, and so I'm probably going to dodge again. No, I mean, I think it's an important question. And Jayla, these are exactly the kinds of questions that I would ask the Department of Public Health head if they would give me an interview with her, but they haven't yet. So, I mean, I think it's this question of what do we need to open up, right? If we acknowledge that economic hardship does translate to well-being, both mental health, both physical health. It is physically difficult for people to deal with economic hardship. It is not good for their health. If we acknowledge that, I think the next question is, okay, well, how do we start to safely allow that economic activity to continue, to ramp back up? The people that I've spoken with have really focused on the value of two main things, and you may have heard this before, testing and contact tracing. So testing is, we want to know not only, and there are two kinds of testing. So we want to know who has it, who is currently sick, and we want to know who had it, who was sick, and maybe they have recovered. There are such large gaps in our knowledge about both of those numbers. And while public health officials here in the state of Georgia have tried since the start of this thing to ramp up capacity to figure out what those numbers are, especially more for the who is sick number, it's still not there. And public officials will tell you it's not there. We simply don't have enough testing to figure out who was currently sick with this thing. And what that makes harder is the contact tracing part of it, which is, once we know, say I am sick, we then need to figure out who I have been in touch with, who I have been in close contact enough with to potentially infect them, and then so on and so on, who they've been in contact with and they've been in contact with. State officials said today, so they do that kind of public health detective work all the time for sexually transmitted diseases. And so the state does have some capacity to do that. But what they're doing is trying to ramp up to 1,000 contact tracers. So far, they say they have a few hundred who have been hired. And even if that 1,000 number was enough, which I would say the real public health people would probably say it's not, we're still not even to that base level. So should social distancing be stricter? I think maybe the answer to that question is, well, what systems can we put in place so it doesn't have to be? And I don't know if we're there. And I think, if you were asking that question to the governor, I think he would still say too, there was more that we could be doing. So I think it's maybe not just should we all be staying at home, because I think we all understand that long term, that's not sustainable. But what can we do to start to change that? And I think that the answer to that question is much more important.
Well, that kind of goes into the next question. One of my classmates asked, if the curve does not flatten and hospitals continue to exceed their limits when it comes to taking in patients, what do you think some of the best steps that we could take as citizens should we do?
That's a great question. I mean, I will argue, I will maybe push back on the premise a little bit. I mean, hospitals have started back some elective surgeries, which I think is a sign that they're not bursting at the seams, you know, because they canceled across the board elective procedures, maybe in March, just to kind of make sure they had space and they could train people and that kind of thing. So I don't know if we're at capacity. What we can do, that is a harder question to answer. You know, I think, because this is honestly a conversation that I'm having with my family, I'm having with my friends. It's my job to cover this, and I still don't always feel like I am completely sure about what to do. I think there are a few things that I would feel comfortable saying. I don't have many elderly relatives. If I did, I wouldn't go see them. You know, we've seen in the state of Georgia, there are numbers out today that I think the governor said 2/3 of all of our cases in Georgia were among people who either had a pre-existing medical condition or were elderly. And so that's a pretty clear sign that these are people who are vulnerable to this thing. And so that, I think, is a very practical thing that people can think about is, you know, if you do have someone, a relative who has a pre-existing medical condition, you know, maybe they've had lung cancer, maybe they have diabetes, maybe they're immunocompromised for some reason. Like those are situations that, like, personally, I wouldn't take the risk to go see that person because I would be so afraid of being a vector and somehow getting them sick. And the same for elderly relatives, you know, like if you do have a grandmother who's in her 90s and has maybe had some health struggles in the past, it's going to be hard not to go visit her because, you know, maybe she's lonely, maybe she wants to see you, but like that feels like an accident waiting to happen. And, you know, so for me, that's how I think of it. I will say this entire time, even though I have dramatically cut down how I've gone out into the world, I have still gone out into the world. You know, I've braved the DeKalb Farmers Market a few times, and if anyone has been there, you know how crazy it is. Granted, I'm not going on Saturday afternoon, and I'm wearing face protection, and I'm wearing gloves, and I'm trying to stay away from people. But the rest of the time, I'm staying indoors. So, you know, for me, the advice I would offer would be really think about who is vulnerable here. And if you are in any power to protect them, try to do that. And, you know, really think about the trips that you need to take out into the world that are necessary or not. I'm not running out on the Beltline because I can have, you know, there are other places I can go running, and I've found a way to work around that, but I'm still going to the grocery store because I need food, right? So I think it's a question of really thinking about what do you feel like you need to be doing? At least that's how I'm thinking about it.
Yeah. So there's been talk about a second outbreak later on this fall. Do you have any like opinions on that? Do you think that is like something very possible?
I mean, I think that the example that everyone thinks of is the 1918 flu, which had kind of died down in the summer and then spiked back up. The thing that I'm more interested in to see what happens is not so much a kind of dip in activity and then, you know, not like the camel's back that rises back up. The thing that I'm actually kind of curious to see more what happens is whether things plateau. And so not necessarily that we have this other big spike in cases, but do we just have kind of a running number of cases where this thing is maybe constantly burning through a certain percent of our population, and, you know, infecting kind of a set number of people for the next period of time. I think, you know, the public health experts and officials I've spoken with, you know, including the head of the CDC, have said that, like, this thing is going to be around for some time. And I think Jayla, the thing that I have been really struck by is, so if you look at Georgia's numbers of total infections, which I don't know the number off the top of my head, but it's actually, let me look this up right now. Sorry, this is why I want to do this on my computer so I can pick things up quickly. So, okay, so on the Georgia Department of Public Health's website, currently, this was as of this evening, they have confirmed 31,580 cases of COVID, right? Even if that number is even if that number is an undercount, I say a factor of 10. So even if we are only catching 1 in 10 cases as they happen, that would still mean that upwards of 90, probably more like upwards of 95% of the entire population of the state of Georgia hasn't been exposed to this thing. And so when I think about a second wave, what I like to think about, and I don't like to think about it because it's scary, is the fact that because this is truly a new virus, if 95+% of us are still susceptible to this thing, that's scary to me. And, you know, so will there be a second wave? I mean, I think it's a question of how do we keep that from happening when 95% of our bodies haven't been exposed to this thing? And so, you know, that I think is what worries me, and why I do think this is going to go on a lot longer. Even if we go back out, I think there's a chance we might have to shelter back in place again, just because there are so many people who are vulnerable. I saw, I think it was in a Washington Post article that they wrote, like, because those numbers are kind of the same across the country, that upwards of 90-some% of us are vulnerable, that we're all like dry kindling on a forest floor. I mean, it's not one spark can set it all on fire again. And so yeah, I mean, I think it's totally possible.
Mm-hmm. So kind of moving into school systems and things, my friend Sarah Ann had a question about, so basically a lot of private schools and schools all over have either had to cut down their class time or completely cut off like kids even like learning. And so do you think that will greatly impact students moving forward if they can't really catch back up to this curriculum and what they would have been learning during these times?
Jayla, I feel for y'all. I really do. I can't imagine being in high school at this time. I mean, yeah, I think that's a great and it's a very important question. And I think it is a question of, I like to think too, this is a decision we have made. We have decided to go. We have decided as a country that it is safer for us to be at home, but there are costs to that, right? You know, one of our education reporter, Martha Dalton, and I have talked about this some, and she's much more in touch with the schools and the students and how they're doing. I mean, I think what's really happening is in school districts here in the state that are maybe, you know, underprivileged. You know, there are parts of our state that don't have great access to internet. There are kids who who aren't fortunate enough to all go home with a computer from their school. It's hard to imagine those kids not falling behind in some way. Just because if you don't have the resources to even connect, then how can you expect a kid to catch up? And the kind of cohort that I'm really interested in seeing, you know, I spy some Galloway administrators on here, so my heart goes out to y'all because I know this is a hard thing to try to juggle, is that kids who are maybe, you know, certainly once you're in high school, you have, you know, you're tech savvy, you know how to log into things. You know, Jayla, I'm sure you were raised on a computer in even a different way than I was. And so, well, but you know, you're much more comfortable with this
Yes.
kind of interaction, right? And so, you know, I'm worried. You know, I'm interested to see what happens with the kids who are maybe a little bit younger, who need more of their parents' help to do something like this. Even though that's also assuming that like an 8-year-old hasn't also grown up in front of a screen, in front of a camera. So, you know, I think only time will tell kind of what the long-term effects are. I will say, as with kind of distance learning, remote learning, however you want to talk about it, we've seen something similar in the healthcare space, where telehealth for years and years and years, lawmakers, especially here in Georgia, and advocates for it were like, oh yeah, telehealth, it'll solve all our problems. You don't have a doctor in your county, get a broadband connection and put a computer in there and we can get a doctor to call in. I think that this pandemic is really showing us the limitations of that kind of experience. And I would also think that we're really like, we're going to see the limitations of this kind of like remote learning in the same kind of way.
Okay, so our last kind of couple of questions are kind of about like what sources and resources that we can connect ourselves to. And so Ian, one of the classmates in my human diseases class, asked, what would you say is the best source for data about the coronavirus? And he's looking more for stats by cities and our reproduction rates especially.
Ooh, okay, these are good questions. I would say the one, and I'm gonna have to check some of these out because I just wanna make sure I'm giving you the right. So the one I mentioned earlier, which is the Johns Hopkins University COVID map, is really, really good. That is, for a long time, was my, and I think everyone else's go-to for just kind of a sense of what this outbreak looked like around the world. There was some administration official, and I'm trying to blank on who it was, but there was someone pretty high up, either at Health and Human Services or CDC, who tweeted about the Johns Hopkins page being down and like what was up with the website because he wanted to look at that data. And so you had like a pretty high level federal official not relying on a federal source, which was interesting. And yeah, so Elizabeth, I can drop these links to you here. So yeah, so this is the Johns Hopkins COVID tracker. It's still kind of where I go to. Let me see, the other one is put out by STAT, which is a health publication. And this is the COVID-19 tracker. And this actually is kind of like the Johns Hopkins one, and it's got cool breakdowns. You can actually like click on different tabs and see how kind of the numbers change. If you give me a second to look through my Slack, I was sharing something about the reproduction rate recently with a colleague of mine. And so there seems to be a little bit of agreement that we want to get that reproduction rate down to under 1, right? Because then we don't have exponential growth. And so here there is like a live tracker that kind of shows where each country is on that kind of over under 1. The other thing I will say too is that for a time, the CDC wasn't doing the kind of disease surveillance on COVID that they would normally do, that they do each year for the flu. So each year for the flu, from flu season, which is like October to June, I think, maybe April, the CDC will put out weekly reports. Here is flu severity in each state. Here is how many cases we've seen of influenza-like illness, just like really basic public health surveillance stuff. It took them a while to stand up those resources for COVID. They now have them. And so that would be another resource. And I will Google that real quick. Just to, you know, because again, the CDC, even though they might not be the quickest or most responsive, you know, they are the official government line. I will also say too, and I'm sure people in your class have figured this out, but the New York Times has just been killing it with regards to collecting data. And I've even heard stories of researchers looking for data sets, turning to the New York Times for their data set, which is just like kind of nuts.
Yeah.
To think that this like private news organization, of course, with like all the resources in the world, is actually got some of the gold standard data here. So that would just be another one, is just to really see what the New York Times has, because there's a pretty good chance that it's like as good, if not a little better than what you might find in other sources.
Okay. Well, thank you so much for talking today. If anyone that is listening right now wanted more information about topics that we talked about today or anything else, please check out Sam's podcast, Did You Wash Your Hands? You can listen to it on NPR, and it's really great. I listened to a bunch to prepare for this, and so you can check that out for further information. Thank you again, like I said, for talking to me today and answering some of these questions that might have been a little touchy. And so I just appreciate it. Thank you.
Well, sure. And Jayla, because it is my job to ask questions. May I ask you one? How has this whole thing been for you? I feel like this has been, as a health reporter, this is certainly a very serious thing to cover. But I have just learned so much because there's just so much happening now. So what has this been like for you to like be in a human diseases class in the middle of a pandemic?
Well, it was actually kind of crazy because I took economics first semester, and then I went to human diseases. And so when I hear like the government speaking or anyone speaking, I am thinking about like the economy, but also I'm thinking about like what Ms. Sanders has taught me about like herd immunity, and like what you mentioned, how we are still like 91% like not even like affected by this. And so I've been thinking about both sides of it. And so it's kind of crazy based on the classes I've taken myself to think about like everything put together instead of one aspect of the virus. And so, and also I'm a senior, so I've also been thinking about it like in my heart because I have to, miss out on things. But I'm just happy that hopefully we're getting towards a positive, and I'm helping in a way.
Yeah, I mean, and I will say that's the real thing that there's a lot of information out there, but I do think that if you kind of know where to turn, in this time when we all have so many things that we're uncertain about with this disease, there are places that you can turn for probably better information than others. And I think if you have this sense that like no one knows the complete picture, like I would say that's probably the thing that like people watching this, I really want them to leave with is, not just covering this pandemic, whatever topic I'm covering, they're really, really smart people who are the closest to the ground, to like the bleeding edge of knowledge, are very aware of what they don't know. And I think that it's, you might assume that someone who has more questions they want answered maybe isn't working on it hard enough or isn't confident. But I actually think it's a much more realistic understanding of the situation, that we still have a lot of questions about this thing. And Jayla, a conversation that we have now is going to look totally different than a conversation we would have a year from now, because we're going to know, we're not going to have full knowledge, certainly a year from now. That will take years, decades, even I would guess. But they're still in this kind of picture that we're trying to create of what this outbreak and pandemic looks like. That picture is still very hazy. And so I would just caution everyone, if they hear someone, touting a drug or a vaccine with any kind of definite pronouncement, nothing is ever 100% when it comes to a disease. And certainly in this situation when we are still learning so much about it. So yeah, I mean, it's a weird time to be alive.
Yeah. That's true.
Yeah. That's my cue, right?
Hey, yeah, that's your cue. That's great.
Time to be alive. That's what Miss Sanders.
Come on, Miss Sanders.
I just wanted to say thank you to you, Sam, for making time for this. Thank you, Jayla, for conducting a masterful interview on behalf of our class. Thank you, audience. here tonight. Even though we don't see your faces, we feel your presence, and remind everyone that this interview, as well as other resources our class has been working on, will be available. I've put that link in the chat. And just sort of end not only with a thank you to you all, and particularly you and Sam and Jayla, but for journalists. Thank you. I think we've sort of circled all the way around from the beginning to the end of the importance of finding good information and the importance of that role. So to a journalist and an aspiring journalist, thank you for that work. And
we are certainly trying.
So thanks to everyone, and have a good evening.